Now I would like to pass on the words to Ruth, who is going to have an interesting presentation. Thank you.
Thank you, Marleen. I'm going to share my presentation with you. I hope everyone sees the presentation, unless we will take a look at the chat. Good afternoon. My name is Ruth Veenhuizen, and at first I'd like to thank the organizing committee for giving us the opportunity to present our work on nursing home residents with Huntington's disease. It is an honor to share with you our latest results. Marina Eckel is the PhD student whose work I may present for you today. And here you see her project team. And this team consists of a mixture of professionals from the nursing home and scientists from the university clinic. And they have a lot of experience in quantitative and qualitative research. And of course, the professors are the last ones depicted in the pictures. Marina is a PhD student at Amsterdam University Medical Center, and she works as a psychologist in the nursing home at Land. And for me, I'm a nursing home doctor with which is a specialization in the Netherlands. And I also work at the Amsterdam University Medical Center. I'm a research coordinator there for the network with the aim to improve care through scientific research and to improve research through close relations with the field. Here you see the front of our nursing home. Our nursing home is a partner in the University Network for Nursing Homes and in the Huntington Knowledge Net Netherlands, which is a collaboration between the HD specialized nursing homes. And here you see a living room in our nursing home in Atlant. Today, I present to you the data of what we call the Advanced HD study. It has the aim to describe patient and disease characteristics, their functioning, and to explore gender differences. The participants you see depicted on this map. We have 8 specialized long-term care facilities in the Netherlands, and they, excuse me, the NH residents and their nurses and therapists were all participants in this study. The inclusion started in November 2017, and the last patient was included in February 2020. We have a bit of a problem with our screen on the computer. Excuse me. We used quite a lot of measuring instruments, and for now I will focus on the characteristics of the patients and their functioning. General, physical, cognitive, emotional, communicative, and social. I will also make short notice of medication and neuropsychiatric symptoms. In the Netherlands, there are 250 residents in the specialized nursing homes, and they will all ask to participate. And we could include 173 participants. And here you see their age with a mean of 58.3 years. And you can see that there's a wide range of 26 to 83. And this means that about 4 generations of patients live in the nursing home. And you can imagine that the oldest lady of 83 has quite some different preferences than the lady with a nice red skirt. Here you see the age at diagnosis with a mean of 47 and a range of 17 to 82. So the range shows that there's a wide difference in experiencing this disease. The patient with 17 has a disease starting in the early years, and the patient of 82 can look back on his life where there was no disease. The disease duration of these 173 patients was 11.4 years, again with a wide range. People had just been diagnosed, and people were in the nursing home quite a long time and were diagnosed more than, or were up to 30 years before. And you can see that this leads to patients who can really participate in society, up to patients who are being taken care of completely. The length of stay had a mean of 3.8 years, and again, a big range of people who were just admitted until people who were really used to living in a nursing home, up to 15 years. So these characteristics show that all these residents require nursing home treatment and care, and however, there's a substantial variation in disease stage and in age, which leads, of course, to different demands of the patient. When we look at marital status of this cohort of patients, you see that 41% of our participants were married, and compared to the Dutch community in 2019, of the people over 20, that is 53%. So less people are married, and you can see that 21% of patients were divorced compared to 9% in the Dutch community. So a lot of patients are on their own and are widowed, divorced, or single. When we look at education, 91% had a medium or higher education. And here you see the CIG repeat length with a median of 43 and a range of 38 to 56. The total functional capacity was also measured and had a mean of 1.6, which is very low, of course, and a range of 0 to 10, which is rather high for a person in a nursing home, but there was, I think, one person who had a 10. And here you can see that on the one side of the patient, you really see a patient with a TFC of 0, and on the other side, you see a patient with a TFC that was much higher. Still, she required nursing home care. When you go to medication use in this population of nursing home residents, you see that 80% used any psychotropic drug. And of the psychotropic drug, antidepressants were used in quite a large amount of patients. And we know that antidepressants in Huntington's disease are not only used for depression, but also for irritability. It's the first choice. Of course, patients get this medication for neuropsychiatric symptoms, and we measured these neuropsychiatric symptoms with a neuropsychiatric inventory, the nursing home version, and I give you just some brief results. This inventory counts the number of symptoms, and the underlying score 0 is obviously that patients do not have symptoms, and up to 12. And in our population, the mean was 2.5 neuropsychiatric symptoms with a range of 0 to up to 9. So you can imagine that in one person, there are 9 neuropsychiatric symptoms, and they're also living with patients who have no neuropsychiatric symptoms. The MPI-NH also gives a severity score. And again, 0 is the best score, of course, and 36 is the summed up severity score of all the symptoms. And in our population, it was 4.2 with a range of 0 to 21. And what symptoms were there? Here are the most commonly occurring symptoms: irritability, agitation, apathy, and disinhibition. And the majority of the patients suffered from these symptoms. Here is the list of symptoms that are less frequently occurring, but of course you can imagine that someone with delusions in the last week measured in the last week before from treatment, delusion can be very debilitating and can cause lots of work for caregivers and concerns. For the cognition, we use the behavioral observation scale for HD. And here you can see the results from the social cognitive subscale. And you see that over 50% of the patients are moderately or severely impaired. Summing up all these characteristics of patients in real demographic characteristics and in functioning, you see that there are wide ranges in age, length of stay, disease duration, CAG repeat length, total functional capacity, neuropsychiatric symptoms, and cognition. So in conclusion, I think heterogeneity is the proper word to describe this population. And you can see that in their demographics, in their disease stage, in phenotype, and in their functioning. And I was still rather surprised by this because I think they're all having HD, Huntington's disease, and they're all in the advanced stages. They all require nursing home care, and yet we find this heterogeneous population. And as a consequence, care needs are complex and vary considerably, and we need professionals who put their expertise, should be very differentiated and flexible to provide adequate person-centered care. So it really means a lot for working on an HD ward that you need to have a lot of skills. And I want to thank all the patients living in these specialized nursing homes. And I want to thank you for your attention. And of course, all the nurses and participants in our study for this results. Thank you. And especially Marina, of course, because I present her results. And I think I stop sharing.